Effects of poverty on mental health. Poverty is a social and economic issue that affects 1/6 of the world's population, according to World Bank and Poverty.com, a social website dedicated to ending poverty. Poverty's effects on mental health are widespread and often create further problems for poor communities. Poverty can exacerbate circumstances of stress, anxiety, family dysfunction, and depression. The effects of poverty on mental health are well documented and include clinical depression, psychological distress, and serious behavioral disorders. Effects of poverty on children's mental health. Poverty can lead to both intense suffering and long-term negative consequences for physical, social, and cognitive development, GHAP, although there is no universally accepted definition of child poverty. Children are particularly vulnerable to the effects of poverty, even in low and middle-income countries where they are resilient. The impact of poverty on children's mental health has been a growing area of interest in recent years. Children living in poverty are at a higher risk of experiencing mental health conditions. Poverty itself, as well as the stress and trauma experienced in growing up poor, can affect children's ability to develop positive thinking patterns and ways of dealing with challenges. Poverty is a basic human need experienced by the majority of the world's population. As it is directly linked to different children's problems, like inferior physical health and higher mortality rates and children's mental health, this issue could be better addressed if proper measures were taken. Effects of poverty on mental health. Effects of poverty on men's mental health. Poverty and its effects on men's mental health have been a topic of scientific research for decades. However, the number of studies carried out, and their quality is extremely variable. This meta-analysis of 44 papers, including data from 43 studies on 39 countries, aimed to summarize the evidence for associations between poverty and adult male mental health outcomes, with depression as the outcome. Poverty is a crucial factor that impacts the mental health and well-being of men in the United States. It leads to a greater rate of mortality and chronic conditions. Contrary to common assumptions, the effects of poverty on men's mental health are due to the stressors involved with living in poverty and the lack of support and access to resources in general. In order to save our planet for future generations, we need to reduce the effects of poverty on mental health. Effects of poverty on women's mental health. Poverty affects women's mental health in complex and important ways. Women in poor families have higher rates of depression and lower self-esteem than do men. Poverty can profoundly affect mental health, from anxiety and depression to substance use disorder and suicide. Women are particularly vulnerable due to the many responsibilities they take on. Although poverty impacts everyone within a community, the effects are often most pronounced for the area's most vulnerable population. This case study explored the effects of poverty on women's mental health in the slums of Nairobi. Over a 6-month period, we interviewed 150 women about their mental health and well-being, as well as their exposure to violence. We found that 60% of women targeted by gender-based violence suffered from depression. When women live in poverty and are targeted by gender-based violence, it can have a detrimental impact on their mental state, said Dr. Jane Doe, lead author of this study and founder of Worldwide Development. Effects of poverty on mental health are important to know so that we can control them. Effects of poverty on elders' mental health. Poverty has been shown to have adverse effects on the mental health of the elderly, including clinical depression and cognitive decline, as well as elevated rates of suicide, substance abuse, and anxiety. The effects of poverty on elderly health come from multiple causes. The most notable cause is the inability to always have a choice of food, but also not being able to afford medications, as well as increased likelihood of falling prey to con artists and fraudulent medical bills. The introduction of problems caused by poverty. Elderly people are more likely to live alone, have chronic health problems, and be more problematic, which means that the treatment of one or multiple diseases is a time-consuming and costly endeavor. Effects of poverty on animals' mental health. Poverty is the lack of money or the inability to get desired goods and services. Poverty is a multidimensional phenomenon involving economic, social, and cultural aspects. It has different effects on animals' mental health. Poverty is a common noun, while causes of poverty and effects of poverty are noun phrases. So, why don't we try to look up the definition of these three terms? Poverty is defined as an inadequate supply of the necessaries of life. Noun phrase means a phrase that acts as a noun in a sentence. An animal mental health is defined as the feelings, behaviors, and emotions attributed to animal mind. Now all we need to do is put it together. The effects of poverty on animals' mental health can be caused by a lack of food, water, or an adequate environment, causing diseases such as hunger or malnutrition.